Good day, everyone! Here's what every caring cardinal leader should know about the COVID-19 vaccination. First, we will talk about facts about the COVID-19 vaccine. After that, we will know the reasons why do we need to get vaccinated for COVID-19. Next, we will further understand the benefits and risks of the vaccination. This will be followed by the COVID-19 vaccination process. Lastly, we will know the things you need to know before, during, and after vaccination. Any crisis presents the opportunity to help people learn and to be more resilient while building a safer and more caring community. We encourage every caring cardinal leader to get the right information so you can make the right decision in protecting yourself and the people around you through vaccination. United in purpose and mission, we will rise together and in solidarity with the Filipino people and the world, we will heal as one. Through this COVID-19 vaccination guide, we aim to educate one another by providing accurate vaccine information, empower our people to make the right decision regarding COVID-19 vaccine, engage the entire community by keeping everyone informed and making them part of this important journey. To begin, let's review what we know about COVID-19. COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, V for virus, and D for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. The COVID-19 virus is a new virus linked to the same family of viruses as severe acute respiratory syndrome and some types of common cold. Now, a year after the pandemic started, a vaccine is now authorized and recommended by a number of stringent national regulatory bodies, and the race for a safe and effective vaccine has entered into a new phase. But what is vaccination? Vaccination is a simple, safe, and effective way to reduce your chances of contracting COVID-19 cases. Like all medicines, no vaccine is 100% effective, but vaccination will help lessen the severity of any infection. COVID-19 vaccines that are granted with emergency use authorization by the Food and Drug Administration are considered safe and effective based on the available evidence to date. Before any vaccines receive authorization or approval, FDA carefully reviews all the safety data from clinical trials. What are the benefits of getting a COVID-19 vaccine? Safety is a top priority, and there are many reasons to get vaccinated. Getting a COVID-19 vaccine will help create an immune response in your body against the virus without you having to experience illness. Based on what we know about vaccines for other diseases, experts believe that getting a COVID-19 vaccine may help keep you from getting seriously ill even if you do get COVID-19. Getting vaccinated yourself may also protect people around you, your family, your co-workers, patients, particularly people at increased risk or becoming severely ill from COVID-19. Now the question is, who should receive the vaccine first? Because we need to protect our essential health and non-health workforce to secure our front lines. The priority group to be vaccinated includes frontline health workers, senior citizens, indigent population, and uniformed personnel. With the initial limited supply, frontline health workers and uniformed personnel are prioritized since they have higher risk of exposure while on duty and to allow them to continue fulfilling their duties in both the public and private sectors. Vulnerable groups such as the elderly and the indigent population are prioritized based on the principle of equity. Important to note that you need to delay vaccination for the following conditions. Vaccinee is symptomatic, received another vaccine in the past 14 days. Vaccinee is in the first trimester of pregnancy, confirmed COVID-19 infection in the preceding 90 days. Please delay vaccination until near the end of this period. Received convalescent plasma or monoclonal antibody in the preceding 90 days. Vaccination should be deferred for at least 90 days as a precautionary measure until additional information becomes available to avoid interference of the antibody treatment with vaccine-induced immune responses. Vaccination may be subject to physician's clearance for the following: autoimmune disease, HIV diagnosis, cancer or malignancy, anaphylaxis to another vaccine or from an unknown cause, transplant patient. On steroid treatment, bedridden with terminal illness less than 6 months prognosis, persons living with HIV, persons with other autoimmune conditions, and those with a history of Bell's palsy. It is highly recommended that you speak with your healthcare provider first if you fall on any of the aforementioned categories. Historically, there have been side effects associated with all types of vaccinations. Most are expected, mild, and would go away on their own. According to the Centers for Disease Control and Prevention, there are a few known side effects of the COVID-19 vaccine that you should be aware of. Pain and swelling on the arm where you received your shot, fever, chills, tiredness, headache. Side effects from the COVID-19 vaccine are usually mild and should subside within 24 hours of getting your shot. However, you need to consult your doctor. If the redness or tenderness where you got the shot increases after 24 hours, if your side effects are worrying you or do not seem to be going away after a few days, rest assured that you will be closely monitored after to make sure that you are safe. What to expect before, during, and after your COVID-19 vaccine appointment. Things you need to prepare before and bring on your vaccination day. Any of the following IDs for identity verification: company ID, PRC, PhilHealth, or any government-issued ID with photo, birth date, and signature. Informed consent form for COVID-19 vaccination, vaccination card, vaccinee's record set, and QR code which will be provided to you, which can be printed or saved in your phone. The entire vaccination process will take around 45 minutes to 1 hour. To avoid congestion in the vaccination area, the appointment schedule of vaccinees will be adhered to strictly. Please report 10 minutes before your scheduled appointment. There are 5 stations in the vaccination area: waiting area, registration, screening, vaccination administration, and monitoring. First station, waiting area. You will be asked to watch the COVID-19 vaccination guide video while waiting for your turn to be called at the registration area. Second station, registration. Your QR code will be scanned. You will be asked to present your valid ID for verification. The patient information portion in your vaccinee's record set will be verified. You will be given your color-coded wristband. Third station, screening. Present your vaccinee's record set to the nurse on duty. Your vital signs will be checked by the nurse on duty. The doctor on duty will assess your eligibility and fitness to receive the vaccine based on your screening checklist and physical examination findings. The doctor on duty will tag you for allergy precaution if you have a history of allergy or allergies. You will be asked by the doctor on duty to sign your informed consent form. Fourth station, vaccination administration. Your QR code will be scanned by the nurse. You will be asked to present your vaccinee's record set and your vaccination card. The nurse will check your signed informed consent form. The vaccine will be administered to you by the nurse vaccinator. The nurse will fill out the vaccination card. Fifth station, post-vaccination monitoring. For vaccinees without known allergies, proceed to Nurse 1 for checking of your vital signs. On your 15th minute in the area, proceed to Nurse 2 for rechecking of your vital signs. Proceed to the doctor on duty for final assessment prior to your discharge. For vaccinees with known allergies, on your 30th minute in the area, proceed to Nurse 3 for final checking of your vital signs, then proceed to the doctor on duty for final assessment prior to your discharge. Upon discharge, you will be provided your prescription and post-vaccination instructions in case you experience any adverse event following your immunization. At the exit point, your vaccinee's record set, including your signed informed consent, will be checked by the usherette for completeness. Give your vaccinee's record set, including your signed informed consent, in the designated record box. Important reminder, please keep your vaccination card and bring it on your next vaccination schedule. After your vaccination, serious side effects after getting the vaccine are rare. If you develop any serious symptoms or symptoms that could be an allergic reaction, proceed to the nearest emergency facility. Report any adverse events or symptoms following your immunization by accessing the link that will be provided to you. Monitoring and reporting of side effects should be done for a duration of 6 months. Continue to follow minimum safety protocols. Safe and effective vaccines will be a game changer. But for the foreseeable future, we must continue to wear masks, physically distance, avoid crowds, and apply other health measures. Being vaccinated does not mean that we can throw caution to the wind and put ourselves and others at risk. Now that you've learned the following facts about the COVID-19 vaccine, the need to get vaccinated for COVID-19, benefits and risks of the vaccination, Cardinal Santos vaccination process, important things to know before, during, and after vaccination. Together, let us end this COVID-19 pandemic. Let us get educated and vaccinated.